everyone, and welcome to another episode of Crushing Medicare with Z and D. Okay, so on today's episode, we are going to be talking about compliance.
Compliance. Everybody's favorite topic.
Yes, compliance. So our friends at CMS have recently updated their marketing guidance for 2024. How exciting.
Very exciting.
Yes, for Medicare Advantage and Part D drug plan.
So the following rules are going to go into effect September 30th. And so it's very important that you get ready and you understand what these rules are and how it's going to apply to your marketing practices. So you're ready to go and ready to be compliant for the upcoming AEP.
Makes sense.
Well, I don't know if it makes sense, but it's something we have to do.
In this video, we will provide a brief overview on 5 topics. 5 of them.
So the first one that we're going to talk a little bit about is call recording. So our guidance last year stated that every single call to a beneficiary needs to be recorded. This is somewhat lightening up, and only sales and enrollment calls are going to have to be recorded. So that's a good thing.
Okay, so that's topic 1. Topic 2 is disclaimer.
So as we know, on our websites and all of our marketing material, we had to put, for all, for information on all the plans, contact Medicare.gov or 1-800-Medicare. They're adding in the need to put in SHIP. All right, if you're not familiar with SHIP, SHIP is the state health insurance program that seniors can discuss. So that's a small change that I will have to update our marketing materials on.
Okay, interesting. That's true. So we're heading into 3, and it is the scope of appointment.
Scope of appointment, or SOA.
SOA.
So this is kind of a bigger change than what we had last year and in previous years. So CMS is bringing back the 48-hour scope. Okay, so what that means is that you need to have a signed scope of appointment, either electronically or paper, for all of your Part D and MAPD applications.
Completed within 48 hours.
Well, completed before you do the application. So that's certainly going to impact some of the call centers, right, and some of the people that are telesales only. So to be compliant, you're going to need to do a scope of appointment 48 hours before you do the application. There are some limitations and exceptions to the rule that we'll cover more in depth on our upcoming training on the 11th.
It's going to be on the 11th.
All right, very good.
So the next topic is my favorite, sales events.
I know, because you're so dynamic. You are amazing when you get in front of people. All right.
Thank you.
You're welcome.
Oh my gosh.
You're welcome. So sales events. This is, sales events or educational events. This is when you're giving some type of presentation. So let's talk a little bit about educational events. So in the past, when we went out and did like Turning 65 educational events, you were able to hand out an evaluation form. Client or a prospect could fill it out, and then you could call them back. The rules are tightening up a little bit on that. You can't really do evaluation forms anymore, or collect scope of appointments, or do any type of sales enrollments within like 12 to 24 hours of the meeting, which really is not that big of a deal. But the piece that you can do is that you can have the prospect fill out a BRC, or permission to contact note, so you have the right to follow up with them after the educational events, which is a big deal because, to do an educational event the right way, you really do need to invest in marketing. And so not to be able to follow up would be, rather difficult for this marketing tactic.
Okay. Last but not least, marketing materials.
Marketing materials. All right. So I think this is a good thing to protect Medicare beneficiaries. So number one is we can't advertise benefits in an area in which they're not available. Now this may be common sense, but a lot of marketers will be on Facebook and they'll advertise an ad in 6 or 7 states, and that benefit may or may not be available in all 7 states. So you can't do a blanket advertising like $4,000 in dental if it doesn't exist in one state or another. So you have to be aware of your Facebook ads and other advertising.
So it's not misleading.
So it's not misleading, right? And if you're also going to talk about a benefit, you have to quantify the benefit. So let's say one of the more popular benefits is money back on your Social Security, right? A lot of agents lead with that when they're selling MAPD. And so I believe you have to be specific about what that benefit is. Okay. All right. So we're going to cover more of these details on the April 11th training. And so if you're not following these guidelines, It's important that you understand what they are, and we'll probably spend a good hour with our agents, and anybody that wants to join on our training is welcome to do it.
So make sure you RSVP so that you are in the know and you have some reminders sent to you, and we will see you on May 11th at our next training.
All right, we'll talk to you later.
Okay, bye-bye everyone.